All right, this morning we have a story you will see only on Channel 3. Could artificial intelligence replace your doctor?
It's a great question. An exclusive poll from Sacred Heart University, Great Blue Research, as well as our parent company, Gray Media, we combined to get this poll done here. It shows AI already changing healthcare, and the technology's role is growing.
Your reporter, Anna Stansfield, is live in studio breaking down the data. Good morning, Anna.
Good morning, guys. The poll went out to 1,500 people across the country. Their responses reveal AI in healthcare could become as routine as your annual checkup. From long waits to paperwork problems, going to the doctor can be a headache. This just-released poll shows many patients are frustrated with the healthcare system. 38% of respondents listed those wait times as their top concern. Dealing with insurance, financial constraints, and trouble making appointments also topped the list. So how does AI help solve these problems? Well, some offices are using chatbots to schedule your next trip to the doctors and send you reminders as your appointment gets closer, giving healthcare professionals more time to spend with their patients. 2 out of every 3 participants feel they're already seeing AI being used for parts of their healthcare services, and some of them think that role is going to keep growing. 38% think AI will replace doctors for some tasks in the next 10 years, but research experts say this shouldn't scare doctors. Instead, it shows them where patients are willing to use AI, letting them focus on care and not paperwork.
So it's pretty clear Doc is still in the lead for making those decisions and providing that advice, but it's also very clear that AI is going to quickly become a larger percentage of that conversation, that diagnosis, that treatment plan.
And while the poll shows many people are okay with AI being used for simple things like scheduling, they want to be aware when it's being used. I'll have more on those transparency concerns coming up in the next half hour. For now, though, I'm your reporter in studio, Anna Stansfield, Channel 3 Eyewitness News.
All right, Anna, thank you.